Today, I'm delighted to be joined by Claire Edwards, Chair of the Institution of Mechanical Engineering Pharmaceutical Committee. Welcome, Claire. Thank you so much for your time. We've worked together on making pharmaceuticals for a long time now, haven't we? And the IMechE, for short, involvement is very much appreciated by us here at STEP Exhibitions. Do you want to just talk us through the history of your involvement in the event and how the IMechE find being a part of it?
Absolutely, and it's a pleasure to have that opportunity to talk about it. I'm thinking back now. I've lost count of the years of how long we've been involved. So I know it's for
at least 10. Yeah, yes, quite some time.
And it's something that we just absolutely love. It's a great opportunity for professionals throughout the pharmaceutical industry, whether you're in making, research, distributing, to get together, learn about latest technology, share some thinking. I love the talks, and that's why I think as the IMechE Pharmaceutical Committee, we've always really enjoyed giving presentations across different topic areas and really getting that engagement and connection across our industry. So it really is a great opportunity to get together. So I'm looking forward to April.
Yes, thank you. It'll be here before we know it. So the IMechE always put together conference sessions for us, which are always very well attended. We have the IMechE represented in the conference on both days of the event. But you're speaking specifically on what should we be doing in pharmaceutical manufacture to promote good health, safety and well-being in the workplace. So picking up on the safety element of your session, why do you see safety as such an important topic in the making and distribution of pharmaceuticals?
I think because throughout my career, I've worked in many aspects of pharmaceutical supply chain. And the part for me is there's one thing that really connects us all, whether you're in a lab, on the manufacturing factory floor, or, sort of in the warehouse, or even in the commercial office. Safety is important to you. I think as well, it's interesting when people see the topic, they might pick up on safety of the pharmaceutical product, but I'm very much focusing on safety within the workforce. And I think safety gets a bit of bad press. Victoria, also tends to be that sort of say something can't be done, it's because health and safety said you shouldn't, and sort of it's kind of that it's a blocker or something that prevents achievement. And I actually can counter that entirely. I feel that when you get safety right, and particularly the safety cultural elements, it's really the foundation of your business and the springboard to success. So for me, a good safety culture is good business, and I want to encourage it.
Fantastic. So safety is absolutely crucial, obviously. What would you say a robust safety culture looks like, and how do you know you have one? You need that confidence that safety culture is in place, don't you? So you need to understand what it is.
Yeah, absolutely. And building a safety culture is not a quick process. It takes effort, perseverance. There is no wonderful magic wand here that suddenly everything is there. You've got to be continuously improving in this space. But you can use tools. So, the HSE has a really good one, the safety climate tool, which you can use and sort of help you assess in your organization where is safety fitting in. You can even just take a look at your metrics, your performance, what you're getting in your feedback from people. Is it sort of is it purely that your department head turns around and says, be safe today, everybody, but it doesn't say any more than that? That's not really where we want to get to. So for me, that safety culture, there's many elements to it. And I always like to connect to the thought of a sound engineer on a mixing desk, trying to get the best out of recording. And as there's all the different levers, different kinds of elements on that desk. So you can kind of connect that to how do you play the best tune to get the most out of kind of safety. And that might be your management system being really robust, built on really strong risk assessment, understanding how you manage your high severity risks, the way in which you establish good ways of working and train people. I always joke that there are lots of lovely scientists and engineers in pharmaceuticals who love a good procedure. Love a good documented procedure, but I think the bit for me is also what's in that culture is not the piece of paper that gives you the instructions, but how is it, to pinch a term from quality, how is it in place and in use, and how are people kind of living it and actually bringing it to life, that it's not, like I say, hidden in a desk and looks beautiful, but it's not actually being practically used. But I also think one of the things that's really important in your safety culture is actually how are people feeling? Do they feel psychologically safe? I think that's a really important area.
Yes, so people need to feel confident and comfortable coming to work to fulfill their role, don't they? And you obviously just referenced psychological safety. What would you say it means for anyone who's not entirely sure?
It's kind of a very fancy word that's long. So I get where very good point, Victoria, to kind of pick on me to explain it properly. For me, it's an environment where people are not afraid to put their hands up and say what they think. It's creating that environment where opinions are valued and not dismissed, you know. And I think if you want to find more in this space, I always love looking at Simon Sinek videos on YouTube. They're only like a couple of minutes and they give you insight into kind of examples in this particular space. But I'd like to bring it to maybe a safety example. So if we took a manager, say, doing a safety investigation. So say, for example, an operator has picked a cough syrup bottle or a glass vial off the line, and in the process they've cut their hand, and immediately that manager goes down to do the investigation and they shout at the operator and they tell them off for not wearing their gloves, and they make a huge issue of reinforcing that this operator didn't follow the procedure, and if you don't follow it properly, you don't do your job safely, or you will come to harm. They're kind of immediately blaming that operator for the accident. So what if that manager had taken a different tone and went down to that operator and created an atmosphere where that operator felt safe to tell them what had really happened? Yes, they weren't wearing their gloves because the gloves are really uncomfortable, and when they wear these gloves, it's very difficult. The dexterity isn't as good, so they more likely and frightened of dropping the cough syrup bottle. Or we're in a situation that immediately before that task, they have to take their gloves off because they're trying to fill in something on a back sheet or type something into a computer control terminal, which means the gloves are really inhibiting, or it's at a time when someone's asking for samples for the lab at the same time when there's less people around and it's all quite chaotic atmosphere. That manager being open, building that trust, looking deeper beyond scratching the surface, will find so many better solutions. The person feels more engaged. You find that, they feel their business cares for them. And, that business will have the opportunity to get the best out of their people, feeling psychologically safe, and feeling that you can sort of tell the truth and there'll be no retribution for what you say. It means you can't have anything but a better situation for problem solving.
Absolutely. Yeah, it's all about people and communication and interaction. And obviously, communication should start from the top down. So, what's the role for safety for leaders in companies that make and distribute pharmaceuticals?
In short, critical role, a very critical role. If I looked at leaders throughout an organisation, I mean, they set the tone. The tone they set drives the attitudes and the behaviours of people. So automatically, you can very clearly look at a senior leadership team or the CEO of a company, and that I love that phrase, the shadow of the leader. The sort of the shadow they cast will have an impact on a company's culture or their behaviours, how they think, and it's the kind of things they promote. And it might not be what they say; it could be how they act and how they, So that whole kind of part of your shadow having an impact on others. So I think there's a very important part there about what leaders say, do, how they are in a situation. I think there's also, from a senior leadership perspective, they make decisions, and those decisions have a huge impact on people. And it might not be immediately, it could be in 2, 3, 5, 10 years, based on how they chose to structure the organization or what they chose to drive as kind of key business achievements. But also as well, I think it comes down to, and research kind of shows this, that there's a huge role for frontline managers, your immediate line manager. You and I, we've had bosses we work for, and the way in which they interact with us will get a better performance out of us. You know, sort of, I think it's really important that for people to understand safety is important, their line manager has to see that, have active safety leadership in the way in which they behave, emphasize the importance of safety, encourage the involvement, be curious to learn and listen, and challenge the poor practices so that we have the best outcome. And I think then that would really have a great impact on an employee's kind of perception of safety and how they act and how they do their job to the best of their ability.
Fantastic, thank you. So that's a taster of what you're going to be talking about in April. Have you got any final thoughts you want to leave us with today?
Oh, I do. I'm really looking forward to April. I'm looking forward to meeting people here, and by all means, come and talk to me. Perhaps it might be something we've talked about on this session where, Victoria, you and I have been chatting, that sparked someone's interest. So yeah, absolutely for that. I think I'll come back to mechanical engineers. Engineering as a whole has a really important role to do within the making and distributing of pharmaceuticals. And I'd love to meet more engineers in the business, and come talk to us. We can help you in terms of what the institution can do to support you. And again, come and listen to my colleagues' presentations. They have some really fabulous topic areas too, from sustainability to digital manufacturing to maintenance practices. We cover lots of different elements, and we're really curious to chat, debate, and learn more.
You and your team have, I don't know how many years of experience, but many, I would say. So yeah, it's an absolutely invaluable opportunity to come and listen to both the talks and talk to you on your stand. So the IMechE are on stand 823 in the exhibition. Claire, thank you so much for your time today. It's been delightful talking to you. Just to let everybody know that registration at makingpharma.com is open currently. Attendance at both the exhibition and the conference are free. And we look forward to seeing as many people as possible for a fantastic event at the Coventry Building Society Arena in April next year. Thank you very much, Claire, indeed.
Thank you, Victoria.